Now we will go into a little bit more details of the Dragonfly study. And my question to Dr. Osredkar will be completely irrelevant, of course. Why the name Dragonfly? And then you continue with the story. The floor is yours.
Hello again. Well, for the answer, I think you'll have to ask one of the patient groups, because they have chosen the Dragonfly symbol, and it's a nice symbol. I like it very much, but I don't know the answer. So,
all right.
So I will briefly walk you through the Dragonfly, which is a natural history study. It is the first international natural history study of the CTNNB1 syndrome. And since this talk is intended mostly for the parents, allow me as a brief story that about growing a plant. If you want to know how a plant grows, you have to make snapshots of it growing over time, because with that you will be able to understand how it develops from a bean to an adult plant. And if then you do an intervention such as shine some more light on the growing of the plant, you will be able to then say whether this intervention, whatever it is, in this case the sunlight, will help the growth of the plant. And if we go into a more kind of scientific way and compare this plant now to our group of patients, if you have a comparison group, which is a natural history study group, which is the blue line here, and then have a treatment group, which is the green line here, you will be then able to appreciate whether this treatment has done any good by decreasing the symptoms, for example, in the treatment group. So in our CTNNB1 natural history study, we firstly try to understand the nature of the disease, because as you've heard this morning, now it's a very recent discovery. We don't know a lot about the disease yet. There's been many efforts around the world to try to understand the disease more, but there's still much that we don't know. There was a lot of efforts of describing different groups of patients, but we don't have a very clear idea of how the disease develops over time. And this is something that a natural history study tries to answer. There's also a very important bit which we're trying to address, and these are the biomarkers, because can we, have a biomarker in our disease that will tell us in which stage of the disease the patient is, and if you treat the patient, if the patient is responding well, or we should look for other treatment options to better help our patients. It's also very important in clinical studies to have an outcome. Say you want to see your patient improve in the speech domain, or you want to see the patient to have less spasticity. So a natural history study will allow you to target the most important aspects of the disease which you try to treat. And this is important. This goes all the way down to designing the drugs, because it tells you which cells, for example, in the brain you want to target, so you would have the effect you're aiming for. And you have to set relevant outcomes for that. So a well-executed natural history study prepares a group of patients, in our case, a group of CTNNB1 patients for clinical trials. I'll give you two examples of how this can help. And this is the first example is the Duchenne muscular dystrophy patients. It's a disease that affects mostly boys. These boys will develop quite normally in the first years of life, but then they will develop muscular problems for which they will lose their ambulation and so forth. And in this particular study, they looked when, for example, the patients would start to have cardiomyopathy, which is the green line, and you can see that more and more patients with age would develop that problem. Also, going in line with that is the ventilatory problems, for example, the orange lines, and you can see that these problems are much more frequent and occur, in a bigger percentage of patients. So if you have an understanding of disease in this sense, you can then look at how the treatment is helping these patients. And here, if you concentrate on the orange line here, which is the natural history study of patients. I mean, these are patients who have never been treated. You can see that, and if you look at what age they lose ambulation, so when they stop walking and need a wheelchair assistance, you can see that the orange line is falling down, and about 50% of patients will lose their ambulation at about 12 years. And if you now compare this to the blue line, which is the cohort of patients who have been treated with steroids, you can see that this is now significantly different to the cohort of patients who have never been treated. So, for example, in this study, they were able to show that by giving patients steroids, they were able to prolong ambulation for about 3 years. And you can go even a bit further. This is an example of spinal muscular atrophy. Here, the patients are losing their motor neurons and they become increasingly weak. Also, so if you look at the natural history studies, which are the orange and the gray lines at the bottom, and you start treating these patients when they already have developed symptoms, you see that these patients would increase in their motor capabilities. But you can go a step further in asking the relevant questions. How does it help if you start treating these patients really early? And you can see that if you start treating these patients in the pre-symptomatic phase, many of these patients will increase much more than if they were treated symptomatically. So, and if you're able then to compare all this to the natural history study and show that this medicine is really working. And this is incredibly important when you have, even if we are lucky enough to, at some point, we'll be able to have a therapy, we need to know whether this therapy is safe and if it's efficient. So we already, I mean, many of you have participated in the genotype phenotype study, and I'm happy to announce that we are just about to finish all the analysis, and the paper is almost ready to be submitted. And but this was a snapshot in time. So, for example, if you look at the lower part of the picture, when we were looking at walking, we were able to see that 50% of CTNNB1 patients that participated in that study were able to walk eventually. But as you can see, many of these patients would start walking close to 15 months, so quite late. So we understand now that our patients have a problem in walking development. And we've looked at other things here as well, when they were able to crawl, when they were able to babble and so forth. And we can say something about the disease. But as I said, this was a snapshot in time, and we need to understand how this develops over time. So besides this being a scientific congress, it's also a beginning of an international natural history study. And, you know, as we are speaking, you know, there's patients being evaluated on different domains around this hotel, but we'll also take them around to our hospital, but to also to the ophthalmological clinic to be properly examined. We have had an ethics committee approval from Slovenia for the protocol of the study, and we will adapt it if necessary. If we find out that what we're doing now is maybe not the most appropriate thing to how to examine a child, we'll adopt it to best suit our patients. We aim to be able to follow the patients for at least 5 years, but there's always a chance that we can prolong it if everyone is agreeing on participating even further. And what we are also trying to do is to make it kind of more easily available for the patient. So we do appreciate that you came for very far around, as far as possible, really around the globe. And I know that this is a very big burden for to travel with kids that are not so keen on traveling. And we might be able with time to kind of have multiple sites which will be able to examine our children, you know, with the same method, collecting the data in the same database, and we'll still be able to get the relevant data that we are aiming for. So we also, we will anonymize the data, and we will definitely analyze them and publish them, so it's available to the whole community of CTNNB1 researchers around the world. And I think this is how science should be done. So there's a couple of aims that we kind of placed in the protocol about the Dragonfly study. We want to see what the signs and symptoms of the disease are. We know that although the same gene is affected in all of our kids, the different mutations can be related to different phenotypes. Some are more severe, some are less severe, and we want to understand that even better. We want to understand what tools do we need to evaluate our children, because we need to have such tools to be able to say something about a particular child and how the child is going to develop. And we also try to understand what the impact of the disease is on patients and their families, because obviously we will try to aim for a treatment that suits mostly, you know, the most important kind of relevant issues for the patients and families. We will try to collect some biomarkers, and here I would like to underline again that all this is completely voluntary. If your child is not able or doesn't want to, or you have other reservations about this, any kind of examination, please let us know. Nothing is obligatory here. We also try to have a snapshot of whether the parents are interested in participating in future clinical trials, because we are already preparing a clinical trial in the case that we'll have a successful treatment in the following years. And I strongly hope so and believe so. But of course, we have to follow the rigorous scientific and legislative procedures to be sure from all possible perspectives. We also need to, I mean, the good reason about such a, to have such a natural history study is also to connect. And I think we are doing a great job with connecting with all of you and all of us. So as I said, there have been a lot of families coming from all around the world. It's been said before, 82 patients and families from 19 countries, which is incredible. I'm still overwhelmed with the fact that we managed to get all this this amount of patients to Ljubljana, and I'm incredibly grateful to all of you for you know, injecting all these efforts to make this happen. Participation is completely voluntary, and as I said, you can always say no to any of the you know, to the examinations that are being performed. We have, I don't want to burden you too much with everything that we'll be doing here, because you will learn this on the fly, but we have generally kind of for the sake of examinations, divided our patients into 3 groups of those who are less than 4 years, those who are more than 4 years and are non-ambulant, and those who are more than 4 years and they're ambulant still, because of course not all examinations can be performed on all kids. We will be collecting some existing data. For example, those patients who were able to get Bayley scales of infant and toddler development or Wechsler intelligence scales, we asked them to bring them with us. Also, the EEG recordings, if they were performed in the local environment, we kindly asked the parents to bring them with them. And also the MRI scans, we don't have the possibility of doing MRI scans here, but this is also a very important thing for understanding of what this gene mutation does to the brain development. We know a bit more now. We know that how neurons kind of connect among each other in the brain is kind of disturbed in the CTNNB1 patients, and we want to understand this much better. And for that reason, MRI scans are really valuable. So we'll have, each patient will be clinically examined, and we'll take some demographical data. We'll ask you about past medical history, some comorbidities, and then a general medical and neurological examination is going to be performed. We'll also monitor the motor milestones, and there's some other fine details. We're going to look, for example, for dystonia in your patients, in our patients, and you will, so it will last about an hour. Looking at cognitive function, we look at Bayley scales of infant development and Wechsler preschool primary scale of intelligence. And looking at language and communication, we also will use these 2 scales, but also look at other assessments such as adaptive behavior assessment system and Vineland adaptive behavior scale. When looking at adaptive skills and behavior, we'll also look for autism, and we have different questionnaires for detecting problems in that field. And we'll also ask about the quality of life measures related to your family. As I said, MRI and EEGs are going to be collected if possible. And for the EEGs, we also had the opportunity to record some in our hospital. And we'll also do the optical coherence tomography, which is a retinal scan. And this will be also an important measure to evaluate, because we know that eye problems can be part of the syndrome. For a selected group of patients, we'll also use a wearable device. Laurent is leading the field in this part, because this is a device that you can place on the ankles of the patients, and then using very sophisticated computer analysis, you can actually see how the patient moves, and maybe This is an additional tool, like a marker, that will be able to show us whether, how the patient develops, but also whether, if you treat patients, whether the patient's movement is actually having some sort of qualitative changes that can be appreciated, and will show us whether, the treatment is effective or not. And this is, for example, a device that has been approved, for example, for DMD patients, and it is one of the important outcome measures in any clinical trial related to that group of patients. We'll also make photographs of children, because we would like to see whether we can use, again, artificial intelligence in recognizing these patients. And Face2Gene is it's an academic kind of collaboration, and they have been very successful in putting a lot of logic behind, facial recognition, connected that with the genetic problem. And you probably know that the CTNNB1 gene is a very common gene which you can find in cerebral palsy patients, because we now know that about a third of cerebral palsy patients actually is not cerebral palsy as we know it. It's not a problem of birth, but it's actually genetically caused. And CTNNB1 gene has been found as one of the most common genes. So if you had such a tool, for easy recognition, then you could use it in clinical practice. And even if you're not very familiarized with the CTNNB1 syndrome, and the program will tell you this might be a child with the CTNNB1 children, which is very important for early detection of these patients. As you can see, as you were able to see on the previous slides, early treatment is also usually related to a much better outcome. For those who will be willing to do so, we will draw some blood. It's going to be 8 milliliters of blood. We'll try to analyze it for DNA methylation, which is a method of looking at how DNA changes over time, especially if a certain intervention is being introduced. We'll look for RNA expression, and we'll look for various biomarkers. For example, neurofilaments is a biomarker that have been used with success in the SMA field, and it's a marker of neuronal degeneration. So if you would have a treatment and you would see a fall in the levels of neurofilaments, you might be able to say that your treatment is effective. So with that, I'd like to conclude and say that a natural history study is truly a team effort, and it requires massive collaboration. I think us sitting here is a proof that this is possible in the CTNNB1 field. And I thank you all, to all the patients, all the families, and all the healthcare professionals, which we heard are more than 30 volunteering to do the examinations here. And all the volunteers, there's over 100 of them helping in managing the whole process. And I think this is a very important and crucial step to the next phase, which is a clinical trial of a potential disease-modifying treatment. With that, I would like to thank you.